Hi, everyone. I'm Steve. I'm here with Dr. Nario for our regular weekly discussion. Thanks for being here, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so if you guys watch, you know Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check them out online and see what their different services are and see what they do. So, we're going to talk about something that's just, to me, hard to even describe. And you have a machine there and you draw blood in your clinic, and has to do with the platelets. And so this is a anti-aging type process, and it's a healing process. So first, tell us what this is called, and then I want to know what the process is of how to actually get these platelets.
Okay. All right. So, Steve, anti aging isn't just creams and serums, it's your body's own repair kit. Imagine drawing a tiny bit of blood, spinning it, and turning it into your personal collagen factory. So, that's called platelet rich plasma before. So, that was the older one. Now it's fibrin. So, that's a better version of the plasma. And this is actually a slow release, all natural use serum your body's been making all along. And now you don't need any subscriptions requiring for you to have this. Now you can actually extract it and use it for your own benefit.
It sounds interesting. What do you mean by a tiny bit of blood? You said a tiny bit of
Yeah,
blood.
so we're gonna draw blood out from you in a test tube, and this is something we just spin in a centrifuge, and they're gonna separate eventually. So the red blood cells are gonna be on the bottom, and the fibrin, or sometimes the plasma, is gonna be on top. So you're just gonna get that clear fluid out, and now you can actually inject it on patients. So what is exactly PRF? So PRF is mostly, as I mentioned to you, an upgrade of PRP. So we don't use any anticoagulants, no additives, just your pure blood spun gently to form that matrix, that fibrin matrix. And why we like that matrix is because it releases growth factors, stem cells, and even cytokines for the duration of 7 to 10 days. It's like a depot of releasing good things to your body in a continuous fashion. So think of it as a biological time release capsule for tissue regeneration.
So this is plasma rich fibrin is what you're
Platelet,
spinning
platelet
spinning
rich.
to get. Now, can you inject this into an injury, or would you
Yes,
do that?
that's right. So, yeah, majority of the uses of this are actually for joints. So it's called articular injection. So standard for knees, shoulders, hips, and smaller joints. And again, this is something that it's easily injected. So a lot of orthopedic clinics they do this. And you can also inject on your tendons and your ligaments, for example, Achilles, rotator cuffs, and you can also combine these PRFs with hyaluronic acid, for example, with your stem cells, your exosomes, and they have actually synergistic bone and ligament protective effects when you do them all together.
Sounds fascinating. So, plasma rich fibrin is what you're spinning out to grab, right?
Hmm.
And then you can inject it. And this comes from your own blood, your own
Right.
body.
So when you mention
And then
right, so go ahead, sorry.
go ahead.
So when we're worried about, you always hear about this controversy that, well, I don't want to. People get their own stem cells from their fat, for example, right, or their own body. You're gonna always have this conversation of you don't want to have old cells because they're not the youthful quality ones. In this situation, that's not the case. This is still going to be helpful because this is actually activating or using other components of your blood, which is the more healing part of your blood, which are basically the fibrin and the platelets. So this is not the case that, oh, you should be a younger source. This one still helpful if it's coming from you.
Wow. And are other I'm assuming that there's other clinics doing this treatment. Like if one of our listeners is on the East Coast, they could probably find someone doing this treatment.
Yes, so it depends on the practitioner. You definitely have to be trained. The thing there is it's around. I know a lot. That's why I mentioned about orthopedic practices having this because that's the most prominent one. And also the other one is aesthetics. So aesthetics actually are doing this, and how they use this as facial rejuvenation. So for example, instead of using fillers or actually Botox, they actually inject this in specific, I guess, wrinkle lines. And this is now a long way to maintain that in terms of collagen remodeling, and also hair clinics. So they're using this to stimulate hair follicles if you're going bald, and increasing the blood flow as well. And that's why it's like sending a memo to your hair roots that they're not retired yet and they should wake up. Another one would be dermatology, so skin healing and also scarf remodeling, and easier and faster times of recovery post lasers and microneedling, meaning the one that makes your face smoother. And they also inject that during these specific procedures. So these are, again, I mentioned to you, natural alternatives for fillers, no foreign gels, just your own bio scaffold. And they also use microneedling. I don't know if you know about that, but they kind of put little pokes in your face, and they insert that also to make it heal faster and for better collagen cross-linking or strength on the facial area. So there's so many ways now in how you use this, and we're just getting started with this, and there's going to be more in the future, I'm sure.
Yeah, wow, I bet. So the microneedling, like someone could roll under their eye, right?
Hmm.
And then they do the injection, or do they do it in reverse?
No, you need to do the microneedling first, so that's where the entry actually goes into. So that's where
Or they
you
might do microneedling on your head and then they do the injection here.
that's right. And I right. Go ahead, sorry.
Um, so very fascinating. And this is all natural. So it's not, you know, um, people that do the Botox and everything, they keep doing it and then pretty soon they look weird, and not only do they look
They
weird, they don't even look like
they
themselves.
all look
It's
the
like,
same.
ugh. Yeah, it's like, ah. So I'm assuming that this is much different than that.
Right. And how to make it different. We just spoke about this off cam a while ago. Peptides, right? How can you now integrate this with peptides? You can. So peptides such as the GHKU copper, thymosin beta 4, this can also be combined with that for faster healing. And also when you mentioned about your favorite NAD, as you mentioned a while ago. So NAD is actually something that you could use with this. It can be injected, yes, but they actually do this IV form while you're getting the PRF, and also exosomes. So you can give injectable exosomes along with your injectable PRF. And sometimes they do IVs also. But again, I'm not promoting that, but there are some practices that does that. That's why it can really be combined with so many integrative therapies out there to maximize the effects.
Yeah. So just so all of our listeners know, you're an integrative physician, meaning you kind of combine holistic with a number of other things, functional type treatments, functional and holistic, which, I really appreciate because it's, looking at the natural ways to do it first and then looking at all your options. So that's kind of cool that it's not, this whole medical approach is not closed-minded, right?
Definitely not. And another one that you can add in there, forgot ozone. So if you like ozone injections for joints, tissues, you can also combine this with your PRF. And what I also remembered are, of course, our men and women who actually likes to enhance, for example, sensitivity down there in the vaginal area, and also for men who has ED or erectile dysfunction problems or scar tissue issues, you could actually inject there using PRF, and it increases lubrication, increases vascularity, and actually it promotes repair of these specific areas, thus more satisfaction for our men and women out there.
Yeah. Now, I'm thinking of some questions like, I'm not the doctor. You are a doctor, but you're not our listener's doctor. Well, some of them you might be,
Mhm.
but people need to check with their physician because there's so many moving parts here, right? Because I was just thinking, if this plasma treatment, if you have an injured tendon or something, you could, because we were talking about stacking, your physician might want to stack it with BPC 157 and TB 500, right? Those three things together for faster healing.
Right. And that's not a contraindication. As I mentioned to you, PRF works with almost anything. With the literature that I have scoured, I really don't see any bad effects from it. The only investigational part right now is the IV part. It's not something that you can probably do IVs yet. And also intranasal delivery, that's also under investigation. But overall, there's just so many more advantages over disadvantages using PRF.
Wow, yeah, it's there's so many. You really have to have a physician who's kinda into this, right? Because there is so many variables and so many different ways and things you can combine this with, right?
Right, right. And that's the thing. Don't be stuck with the idea that I'm always saying it's injectable. There's also a way that you could actually use it as a topical. So a good example for you would be dental surgeries. So for example, you have dental implants or bone grafts. What they do with the dentists actually they remove the membrane and they actually it or put it on that specific area where the healing needs to be, and now it becomes like a scaffold of which actually is going to be absorbed in 7 to 14 days, and it will release a lot of growth factors in the system. So the specific growth factors would be VEGF, TGF beta 1, IGF-1, PDGF, even fibroblasts, endothelial stem cell activities, all of that actually promoting the healing of that specific area of damage. So it's not only injectable, it's also something that you can rub on specific areas.
Yeah, so listeners, ask your physician about this if you're curious about it. So, any last thoughts, Dr. Nario?
Yeah,
Anything that you would
so
add on this?
right, right. So the thing here is again, there's so many different ways now how to heal the body. We always we come up of so many come up so with so many options out there. It's just that it doesn't have to be something that you have to get outside of your system. But sometimes all we need is just to look what we have in the inside. So thus maintaining our own health is always going to be beneficial if you're going to be choosing PRF or PRP because if you again going back to our integrated foundations, eating right, taking care of self, less stress, and proper exercising will actually ensure you to be having better platelets and fibrin that you can actually use on your own. So that's why it's always going to go back to the basics.
So, for all of you, we're talking about platelet-rich fibrin. So, if you have questions, put them in the comment section. And Dr. Nario, as always, thanks for being with
Oh,
us.
Steve, thank you again for having me. As we all know that our knowledge is your power to better health, and thank you for letting me provide you with the edge on longevity and health maintenance, which I call the biological edge or the bio edge.